Hi, my name is Marlena Lopez. In this review, I aim to explain the rationale for the use of Benazepril in the treatment of chronic renal failure in cats. Chronic renal failure is one of the main causes of morbidity and mortality in cats. Chronic renal failure may result from an array of different pathologies, all of which can lead to a gradual and irreversible decrease of the glomerular filtration rate, resulting in a loss of renal functional mass. Studies have found that decreasing glomerular pressure and the sequential proteinuria with pharmacological intervention can delay the progression to end-stage chronic renal failure. Benazepril is an angiotensin-converting enzyme inhibitor. ACE inhibitors lower glomerular pressure by decreasing systemic blood pressure and inhibiting the formation of angiotensin II. In an experimental trial comparing the efficacy of the drug Benazepril versus a placebo, they found that the drug was able to reduce proteinuria in cats. In this study, the diet and the concomitant treatments were standardized as much as possible to minimize biases in the trial. Additional mechanisms of the drug may include inhibition of glomerular hypertrophy and limitation of fibrosis, effects that may be mediated by angiotensin II. The active metabolite of Benazepril, known as benazeprilat, competes with angiotensin I for the binding of the angiotensin-converting enzyme, blocking the conversion of angiotensin I to angiotensin II, resulting in a decreased plasma angiotensin II. Angiotensin II is a vasoconstrictor and negative feedback mediator for renin activity. Lower concentrations result in a decrease in blood pressure and the stimulation of baroreceptor reflex mechanisms, which lead to a decrease in vasopressor activity and to a decreased aldosterone secretion. Benazepril also decreases the breakdown of bradykinin, thereby relaxing arterial muscles and enlarging arteries, allowing the heart to pump blood more easily and increasing blood flow. Two studies indicating that Benazepril had significant effect in delaying the progression of renal failure in cats were conducted experimentally by the use of a placebo and the drug on surgically induced chronic renal failure patients. This was done to eliminate confounding variables of the various causes of naturally occurring chronic renal failure. In cats, Benazepril is eliminated principally via biliary excretion. One study found that the drug does not accumulate in the animal's body, making it a therapeutically safe method for renal failure treatment in small animals. However, since these conclusions were drawn from an experiment involving only surgically induced chronic renal failure patients, this may not apply to naturally occurring cases of chronic renal failure. Another study recruited cats with chronic renal failure into a double-blind, parallel group, prospective, randomized clinical trial, where some cats were given placebo and others were given the drug. There is no difference in renal survival time between the two groups. However, cats that were treated with Benazepril had a better appetite as compared with those given the placebo, as well as a decreased proteinuria. However, this randomized clinical trial does not take into account other disease factors that may play a role in the efficacy of the drug. In conclusion, by decreasing proteinuria and systemic arterial hypertension, Benazepril may be an effective treatment to slow the rate of progression of renal failure in cats with renal disease.